We are going to talk about DUB, or dysfunctional uterine bleeding, or irregular vaginal bleeding. There are 4 major causes for this that I'm going to talk to you about all the 4. Some of the patients have irregular bleeding, irregular cycles. Some of them have postcoital bleeding, which means bleeding after they're having a relationship. And it could be a big issue for a lot of patients. A lot of times it's because of a lesion on the cervix that could be the cause of this, being an abnormal cells or lesions or some polyp on the cervix. Can be diagnosed easily by a pap smear or by exam. The other cause could be hormonal one that could be tested by blood test or by history, and could be managed by some kind of birth control or some kind of hormone therapy. The other 2, it could be something like a polyp. That's one of the reasons that's inside the uterus, or a fibroid, which is a non-cancerous tumor inside the uterus. This can be diagnosed by the ultrasound, or sometimes we do hysteroscopy, which is a procedure. I put a camera through the cervix and look inside and look for any polyp or abnormal cells. There are different ways of doing this, like MRI, CAT scan, or special ultrasound, but hysteroscopy is the best way to diagnose it. Of course, on an older woman, you worry about cancer cell of the uterus, uterine cancer, somebody with irregular bleeding. So those patients, depending on history, age, might need a biopsy or a D&C to rule out any abnormal cells inside the uterus. They're not always cancerous, could be precancerous cells like hyperplasia. It can be treated with medicine or with a procedure like a D&C ablation, or God forbid cancer, you might need surgery and further follow-up.